I've had at least 100 surgeons who've started to do wide-awake carpal tunnel say to me, my patients love it. And here's why.
How sore was it?
Not at all.
What'd you feel?
Felt a little tingle when the first needle went in, and after that it was more or less painless.
Well, I only felt the little needle, and that's it.
The only pain that I really felt was a little prick from the needle.
Other than the first needle, I felt nothing.
I felt a little prick from the needle when you first put it in, and other than that, there was no pain at all.
It's really very easy to inject local anesthesia so that it doesn't hurt for carpal tunnel. This paper and Chapter 4 with its movies show the surgeon how to inject local anesthesia so it doesn't hurt, just as we showed the medical students and residents in this paper that we published in 2012 how to do it. On their very first attempt, 3/4 of 25 medical students and residents who tried their very first attempt at injecting local anesthesia for carpal tunnel so that it didn't hurt were able to have the patients feel just the first poke, just as those patients you just heard in the video. So anyone can do this. It's easy to learn. So in addition to the fact that the local anesthesia doesn't hurt, why is it that patients like carpal tunnel wide awake? Because now it's just as simple as going to the dentist for a filling. They just show up for their surgery, have the surgery, and then go home. After sedation, many hospitals insist that patients need to have someone at home with them after the procedure for safety reasons. This is really inconvenient for people who live alone or for people who have little children. Parents don't want to have a babysitter when they're babysitting. The 4 patients with their hand up have been injected with lidocaine and epinephrine while lying down on a stretcher. They are now waiting for their procedure. We have them wait at least half an hour so the lidocaine and epinephrine are able to work optimally. So, can you please tell me how sore the freezing was?
It wasn't very sore at all. I just felt a little wee pinch when you put the needle in, and that was it.
Okay, thanks. Please tell me how sore the freezing is. What did you feel?
The first needle, you could feel the first needle go in, and then it was just like a pressure. And the second needle, I didn't feel it, and it was just like pressure, just like there was weight on the wrist and part of the palm. And that was all there was to it. It wasn't bad at all.
Great, thank you. Was the freezing and the whole thing?
Not very sore at all, actually. The freezing went very well. It's less painful than going to the dentist, really.
Getting rid of the tourniquet and giving the local time to work gets rid of all the pain. Patients also like that they don't have to take time out of work or get a babysitter to go get preoperative testing like a chest x-ray, an EKG, or blood tests. So the same necessity for preoperative testing that exists at the dentist exists for wide-awake local anesthesia, no tourniquet surgery. They just need to show up the day of the surgery, and that's it. The usual preoperative testing is all about the sedation and the general anesthesia, not about the surgery. In the 5 minutes that it takes to painlessly inject the local anesthesia, and then in the subsequent 5 minutes that it takes to do the surgery, the patient has at least 10 minutes of uninterrupted communication time with the surgeon. The surgeon can explain to the patient to keep their hand higher than their heart, how to take post-operative pain medications properly, what they can do, what they can't do, when they should go back to work, and the patient can ask any question that they have. Not only that, but they remember all of the instructions and all of the conversations because there's no drug that makes them forget. They simply get up, get their coat and go home, keep their hand up, and their risk of complications decreases. Many patients don't like the loss of control that accompanies sedation or the hangover that sometimes happens. They don't need to waste their time to get undressed or be inconvenienced or embarrassed by that, and they never get canceled by the anesthesiologist because of anesthesia issues. This is really inconvenient for patients, and it happens from time to time because of medical problems. Surgery doesn't have to get canceled for medical problems if there is no sedation. The safest sedation is no sedation. Almost all of the nausea and vomiting associated with surgery has to do with the sedation. If you take away the opiates because of good local anesthesia, you take away the inhalation agents and the other sedative drugs, nausea and vomiting goes away. Patients will choose what we tell them is good and will choose what they know. In this study that looked at 100 consecutive patients who got wide-awake carpal tunnel and compared them to 100 patients who got sedation, the same number of patients in both groups said they'd want the same thing again, in spite of the fact that 7% of the sedated patients got nausea and vomiting.
So how was the whole thing?
How was it?
Yeah.
It was all right to me.
So it didn't bother you too much?
No.
Would you rather have been asleep or?
No.
Some patients really are afraid of needles. We explained to them that if they get sedation, most anesthesiologists start an intravenous with a 20-gauge needle. And many of them need preoperative blood testing with another 20-gauge needle. If they have wide-awake carpal tunnel surgery or other hand surgery, we simply can inject with a 27 or 30-gauge needle the first local anesthesia, and if we do it properly, that's all they feel. For patients with multiple medical comorbidities like lung problems or kidney failure or morbid obesity, general anesthesia really can be difficult. Those patients simply come in, have their local anesthesia, get up and go home with the same medical problems that they came in with, just like when they go to the dentist. There's no fasting for diabetics, and people who can't have a tourniquet because of lymphedema or a vascular shunt don't need to worry. There's no need for the tourniquet. The rule about freezing is the don't move rule. It's normal when somebody sticks a needle in you, you want to go, oh. But if you go, oh, the needle comes out before I get the medicine in, so I have to stick the needle back in. It hurts 2 times. If you don't move, it hurts 1 time.
Okay.
Are we good? So at the count of 3, don't move, okay? So 1, 2, don't move. Very good. Now, will you please tell me when the sting of the needle is all gone?
I don't feel no sting.
Don't feel the sting, okay, great. So what was your impression of this whole thing?
I thought it was wonderful.
Yeah, it didn't bother you too much?
No, it didn't bother me a bit.
Yeah, and the freezing, how sore was that?
It wasn't sore.
Well,
just one little pinch.
One pinch, yeah. And then the surgery itself, did the noise bother you very much, or?
No.
A little annoying.
Nothing like what I thought it would be.
You didn't like the crunching?
I pictured drills and...
Right, so it wasn't so bad.
No.
And talk to me about your diabetes now. So today you had your insulin like you normally do, and you had your breakfast and all that, right?
And my metformin pills.
Right.
Yeah.
And so, are you?
I feel great.
You feeling great?
Yeah.
No trouble that way?
No.
And I think you mentioned that a couple of years ago you had a hernia repair.
Yeah. It was supposed to be day surgery.
Right, and you were in
for 4 days.
For 4 days because of you had
fluid build up and anesthetic. I couldn't come out of it.
Right, hard time waking up.
Oh yeah.
Right. Okay. Well, today you can just go home and have your supper. How's that?
That's fine with me.
Okay. All right.
And I appreciate everything you've done.
Okay, you're welcome. Walant surgery is not for all patients, and some patients prefer sedation, should have sedation, and we give them sedation. But most patients don't want sedation when they go to the dentist. Most patients who understand Walant surgery don't want sedation for carpal tunnel. It's actually easier than going to the dentist because they can actually speak because there's no one working in their mouth. Also, many patients like to simply listen to music. Several patients have said that people should put this on their bucket list. They love to watch. Like many surgeons, for the first few years of my practice, I used a tourniquet, thinking that it was only about 5 minutes and most patients can tolerate it well. That's doctor speak for they let me do it even though it hurt quite a bit. Now that we can use epinephrine, we don't need the tourniquet at all anymore. Just like the carpal tunnels, most of the hand trauma in many Canadian cities is now done outside the main operating room in the clinic with field sterility. There's no question that we can do a flexor tendon repair or K-wire a finger better at 2 o'clock in the afternoon than we could at 2 in the morning. This is also much more convenient for patients who can actually remember what we tell them after they have their finger K-wired or their tendon repaired. And they're more likely to follow our advice because they do remember it well.